morning to you all, and I'm really privileged and honored and pleased to be chairing this session on behalf of the Africa Judges and Jurists Forum. Um, the Africa Judges and Jurists Forum is an increasingly influential Pan-African network of eminent women and men judges, as well as jurists who are committed individually and collectively to promoting the rule of law and development in Africa. It is committed to working with the African Union member states to address the huge implementation gap that exists between progressive regional and international instruments that the AU member states have voluntarily adopted, and the practices that are experienced in such states affecting the ability of Africa to unlock a sustainable development agenda for the people of Africa. It accomplishes this goal by providing legal expertise to governments, to intergovernmental organizations, to donor agencies, private sector, as well as to civil society organizations. The Jurist Forum works to enhance access to justice, the rule of law, good governance, and economic growth through standard setting, justice sector and legal reform support, as well as rule of law related capacity enhancement initiatives for the effective realization of the benefits of democratization in Africa. So we are very pleased to be launching this study that was done looking at the state compliance with human rights standards in Southern Africa. All of us know that the advent of COVID really altered the way in which we have lived our lives. The panic and fear that came as a result of a novel virus that had no treatment, had no vaccine, and which was seen as capable of spreading so fast. It really sent a panic to virtually everyone. And as a result, as normally happens when there is little scientific knowledge and little knowledge about the disease itself, the tendency is for people to then look up to governments to be firm, to be strong, and to then treat the virus as an enemy that really needed to be fought hard using all means to protect people. And in that sense, it was not surprising that the main approach, given the way in which the virus spread, that it spread through human beings, the lockdown measures based on declarations of states of emergency or state of disasters became the primary initial mode, and these were generally accepted by many people. And in the process, once there's a state of emergency and there's a state of declaration of national disaster, people accept when fundamental rights are suspended and when fundamental rights are undermined, and in the interests of the right to health. So the securitization of the response to the COVID pandemic also created problems that what Professor Thuli Madonsela said, that the characterization of people as the problem rather than COVID as the problem meant that security sector agencies targeted people. And before we noticed it, the disproportionate impact of the COVID pandemic began to be felt along the structural fault lines in our societies. So the poor, the vulnerable, those with less means became the ones who suffered most because of the incompatibility between lockdown measures and the need for survival, the pains of hunger, the need for water, the need for basic amenities. So as a result, being detained in houses for more than a day or two, for vendors, for people in the informal sector, that's a lot. and it simply meant that it was not possible. And as a result, they started walking the streets and becoming the target of the law enforcement agents. This is just one example. The right to education, we saw that many schools, the education system was crippled. I think it's still crippled in many countries. The right to life itself was threatened by the pandemic itself. Right now, as we speak, there are more than 200 million, 300,000 people who are infected. That's the total number of cases, with 4.2 million deaths that have been experienced. And here in Southern Africa, South Africa remains the epicenter in Southern Africa, but in Africa as well. And it's number 17 in the world, with 2.4 million infections and 72,000 deaths. And as a way of comparison, you will find that other countries in Southern Africa, they are hovering from generally about number 100, in fact 98 in the world. Mozambique is the next with higher numbers. In Southern Africa, 126,000 infections. Namibia, 119,000 infections. Botswana, 115,000 infections. And Zimbabwe, 112,000. I think Lesotho is the one that is the least numbers. But we are currently in a third wave, and a variant, I think they call it the Delta variant, which has been quite rapid in terms of its spread, but also its mortality. I think the mortality rate, you're looking at generally about 17, the mortality rate, it could be, the infection rate rather is around 17% average for Southern African countries, but with quite a steep mortality rate with the Delta variant. So this study, Secretary General Martin, it comes at a very important period where we need to take stock to try and build back better, to try and see how we can prevent the COVID environment of lockdown of human rights from becoming the new normal. So my colleague Debros Mchena always said that it started as a health pandemic, it became a human rights pandemic, it became a socioeconomic rights justice pandemic. It also then became a dictatorship pandemic, because a number of governments have taken advantage of the COVID lockdown measures in order to achieve political rather than public health outcomes. So I think it's very, very important to have a group such as this one, of eminent judges and jurists who can be able to give us, a knowledge tool that can then be used to shape policy and formulate the response procedures. And